this is Brianna Eslick with Nursing 383, and I will be doing my abdominal assessment here and finishing with my musculoskeletal assessment while the patient is supine. First, when I walk into the room, I'm going to wash my hands and introduce myself to the patient. Hi, I'm Brianna. How are you?
Good. How are you?
Good, good. And to start off with the abdominal assessment, I'm going to just do an inspection of the abdomen here. And normally the shirt would be off, but it won't be for now. But I would be looking for any masses, lesions, or abnormalities here on the abdomen, which there should not be any. And then after inspecting, I will auscultate first with the diaphragm of my stethoscope. I will listen in all four quadrants, starting in the right lower quadrant, moving to the right upper quadrant, the left upper quadrant, and the left lower quadrant. I'll be listening for bowel sounds there. And then I will switch to the bell of the diaphragm, and I will listen in the right upper umbilicus and left upper umbilicus for the renal arteries, and then I will listen to the aorta, and we should hear no bruits there. After listening, I'm going to go ahead and percuss all four quadrants again. And I will be hearing dullness over any of the organs, and I will hear tympany over any of the fluid-filled or air-filled cavities. After percussing, I'm going to palpate using two fingers, starting into right lower quadrant, going in circular motions here. And then I will do deep palpation using two hands, and again in circular motions. And there we are feeling for any masses or abnormalities at all, and that should be normal. Next, I'm going to feel for the liver on the right side under the rib cage, and then the spleen on the left side under the rib cage. So I'm going to have the patient take a deep breath for me, and then breathe out, and feel for the liver under the rib cage. All right, now breathe in, and breathe out, and we'll feel for the spleen on the left side there. After palpating there, I'm going to palpate the femoral artery bilaterally, and then I will feel for the inguinal lymph nodes bilaterally as well. That concludes the abdominal assessment, and I'm going to finish with the musculoskeletal assessment while the patient is supine here. I'm going to feel the hips. Alright, and then I will lift up and do range of motion of the hips, and we'll go out and then in. And we would do that bilaterally, and we would want to make sure to listen and feel for any clicks that would be abnormal. And also, while the patient is lying supine, I would look at the extremities, both upper and lower extremities, and make sure that they are equal in length bilaterally, and those are normal. So that completes the assessment. Thank you.